This is Chris Bennett here with Rising from the Ashes, Innovating Wellness from Crisis for Startups Ignite.
You have to imagine the world that will be out there. Then you have to place yourself in that world, find out what's missing, come back and fix the problem. For the current situation, there will be anxiety for the physical, contact between people. So a lot of people will want to stay home, which means that there will be a lot of empty space available in offices and things like that. So how do you go about looking at those problems from that angle? I think I alluded to in between is that draw a system, how the world works, on a paper and the different businesses and different things, and then figure out what will go down and what will go up and see where the opportunity is.
Are there parts of the CARES Act that impact the value proposition for startups, especially those in the healthcare IT area?
Companies are innovating. Companies are thinking about connectedness and how do these solutions work together in order to improve the care of a particular patient population. What has been really clear here is that the patient is a consumer and the consumer is a patient. Okay, we're all impacted by COVID-19. Some of us actually have specific underlying conditions that make us more vulnerable, right? And so at this time, innovation can be applied to an entire universe of people who are susceptible to illness.
Let's talk about innovating through the crisis.
I think please continue innovation. There's no time better than now to innovate. I think we are all in the same boat. The crisis is for everyone, but we need more people to help and start creating solutions. So especially because the government has allowed the reimbursement of the telehealth, I think that opens a lot of opportunities for innovators to innovate in this space. So from the go-to-market strategy, our plan was to go to offices one by one, but because of the telehealth and the significant adoption rates, so we are talking with some major providers. So, and we are helping parents. I think that's what makes Fresh, and I very enthusiastic is, I think that's the most, rewarding power component and interactions with parents, which probably in the future we are not going to do that, but, at least we can enjoy for the moment. Some of the parents that use our platform either don't have a pediatrician, for example, those in Canada or in Australia, or it's hard for them to bring their pediatrician to sign up in order to see the results and then share with them. Particularly one parent was a child with severe case. At one side, we didn't want to share the results because we are a measurement tool. We don't do diagnosis and consultation on treatment. At the same time, we don't want this parent to wait. So I think we found a solution, and that was to find a doctor who can do the analysis and can also have a telehealth consultation.
In the healthcare, one of the key value it created this vacuum of health challenges, and there is a lot of opportunity for the companies to kind of innovate and invent, and at the same time get help from all over the world actually to succeed and create really powerful solutions actually. Startups Ignite is more like a startup ecosystem, and it's a place where we bring in both the startups and the mentors and help startups to grow from idea to like really a product actually.